Okay, so we're going to talk about obstructive sleep apnea now, or obstructive sleep disorder breathing. This is usually caused by enlarged tonsils, obesity, chronic nasal congestion. It's associated with asthma and with prematurity. It's more common in patients with cerebral palsy, muscular dystrophy, Down syndrome, craniofacial anomalies, and septal deviation. So what happens is the tissues in the upper airway relax when that person goes to sleep. That causes partial or complete obstruction. That causes deoxygenation, so their SATs drop, which causes partial or total waking. So their sleep patterns are constantly disrupted. They never get fully to sleep. They can sleep for hours, not get good sleep, not feel rested. So what does it look like? Well, they may have snoring, but it's like a particular pattern of snoring. They may have pauses when they sleep, or sound like they're working to breathe, and then they'll restart breathing with a loud snore. They may wake up tired, morning headache. Bedwetting is associated with sleep apnea, which a lot of people don't realize. Disrupted sleep pattern. When kids are sleepy, they don't just say, "Oh, I'm tired, I want a nap." They act up. So behavior problems in the daytime can be connected to sleep apnea. And daytime sleepiness, which we see more with adolescents and adults. Complications: sleep apnea can cause growth failure. It can cause right side heart failure because it makes it more difficult for the right side of the heart to perfuse the lungs. So it causes cor pulmonale. It can cause hypertension, can lead to stroke. It causes weight gain because it affects not only appetite, and people eat to stay awake, but it affects some hormones that affect appetite, and it affects the way we metabolize our intake. It increases the risk of diabetes. It can lead to poor learning, behavior problems. It can be connected to an ADHD diagnosis because some of the symptoms of chronic sleep deprivation can look like ADHD, and it can lead to death, either because of the apneic episodes, or it increases the risk of a lot of other diseases that can lead to death. So this is diagnosed with polysomnography, or a sleep study. If it's mild, there are some changes in sleep position that can help. Sleeping elevated, sleeping on the side instead of on the back, using nasal strips that open up the nose, the nasal passages can help. Older kids may have a CPAP or BiPAP. That pressure helps maintain open airways. If obesity is a factor, then working towards some weight management. Tonsils and adenoids can be removed if they are enlarged, because that can be a factor. Nursing care is lots and lots of teaching, how to position them for sleep, how to use the CPAP or BiPAP, lifestyle changes that may help decrease this. So lots of teaching. In the next section, we're going to start talking about croup syndromes, which is the middle part of the airway. We're still moving down. So now we're in the larynx and trachea.